Thank you for joining us for another episode of the HR is Daunting vidcast. Today, we're going to discuss mental health in the workplace. I'm Linda Weinzler, a senior HR consultant with the Lindenberger Group. And with me today is Carol Wolkiewicz, a licensed social worker and director of operations of the Lindenberger Group. Welcome, Carol.
Hi, Linda. Thanks for having me.
Mental health in the workplace, that's getting a lot of attention right now. So why now?
Well, I think that it began with COVID-19. COVID-19 really put the spotlight on mental health issues. For the first time, people were actively and openly speaking about their feelings of isolation, their feelings of fear and depression, and employers were really starting to prioritize well-being. Unfortunately, I would say that as normal operations resumed, Linda, support for mental health kind of faded, even though workers really haven't fully recovered.
I have heard this idea that there's a mental health crisis in the United States. What are your thoughts on that?
Well, the data would certainly back that up. The National Alliance on Mental Illness, or NAMI, reports that 1 in 5 US adults experience mental illness each year. That's about 60 million people. And of that number, 1 in 20 or 14 million people experience serious mental illness. So it's really no longer about the lingering effects of COVID. There are a lot of stressors, financial stress, world events, economic instability. All of these things impact well-being. In fact, MetLife conducted a study that showed that 48% of employees attributed poor mental health to financial concerns. So the issue is real and it's here to stay.
Those are startling statistics, Carol.
Yeah.
But how can leaders make an impact? I imagine some leaders look at these numbers and worry that we're trying to turn them into therapists. What would you say to that?
Well, that's a fair concern, but let me be clear. We're not asking leaders to be therapists. We're simply asking them to recognize the impact that work has on mental health. And I also want to take a moment to clarify a couple of things. So poor mental health and mental illness are not the same. There is a wide continuum with poor mental health on one side of the equation and severe mental illness on the other. We recognize that leaders are not in a position to diagnose or treat mental illness. However, we can't ignore the fact that work impacts people's mental health and could have a negative impact.
Say more about that, please.
Well, a healthy work culture can promote purpose. It can promote a sense of community, camaraderie, structure. All of these things can act as protective factors against depression and anxiety, but a toxic work environment can lead to overwhelming stress and poor mental health.
Are there other reasons why employers should take this seriously versus just, their desire to do the right thing for their employees?
Well, that's always a good first start, wanting to do the right thing. But besides that, there's a real bottom line impact, and it's about retention. Society for Human Resource Management, SHRM, found that 1 in 3 workers felt that their job had a negative impact on their mental health. And of that number, Linda, 49% of those people are actively looking for a new job. In fact, just this morning, I had a conversation with somebody who was telling me that the toxic work environment was making her reevaluate whether or not she wanted to stay at a specific organization. And that would be a real loss if she chose to leave. But workers are looking to leave if they feel like that the work is impacting their mental health. They're also looking to leave, and they're searching out companies that do a better job at supporting their mental well-being. The SHRM study actually indicated that 41% of US employees said that they would leave their current employer if the new employer offered better mental health benefits. So if we want to retain our employees, we need to put some energy into their well-being, and it needs to be deliberate and intentional.
Well, this certainly has been difficult lately there's been a lot of movement among employees in different companies. But what about those who stay? Do we see an impact on the population?
Well, some studies estimate that it costs employers almost $48 billion a year in lost productivity. And that's a big number. Yeah.
That's a very big number.
Yeah. And those employees who stay, according to NAMI, depression is the leading cause of disability worldwide. Mental health related leaves of absences were up 33%, in 2024, according to ComPsych, which is a mental health provider. And I would venture to say that if we were to poll the people who are listening to this today, they could tell you anecdotally that they've seen a rise in mental health related leaves of absences. So productivity is absolutely taking a hit.
That all makes sense. But it just doesn't seem realistic to expect that we can wave a magic wand and all these suddenly have these stress-free workplaces.
Mhm. Right. And we're not looking for a stress-free workplace. That's not what employees are asking for. What they're asking for is to be supported, recognizing that stress is a normal part of the workday, but they want signs that their employer cares about them.
Hmm.
And, for leaders who are listening today, I'd ask you to reflect on how are you responding to the needs of the workforce? What is being done actively to support and normalize conversations about mental health in the workplace? It's really all about culture and the culture that's been created. So I'll give you a simple example, but I think it's one that resonates. Do employees feel pressured to stay connected off hours? So by that, I mean on evenings, on the weekends, during vacations, are they expected to respond and to stay connected? Because that expectation itself, as minor as it may be, can drive stress and burnout.
It's interesting that you bring that up. I once worked for someone whose email signature encouraged people not to respond after hours. I've never seen that before. It was very surprising to me, but it was a clear and rare expression of boundaries and the acknowledgement that people have the right to say, my well-being is important and I'm not going to respond after hours. I mean, she literally wrote a statement at the bottom of her email that said that while I'm sending this message to you outside of normal working hours, I don't expect that you should respond until you are back at work.
That is a perfect example. Leaders need to model healthy boundaries. And most leaders will say, but they know that. I've told them that. That's just my style. That's my preference. But until you actively, intentionally, remind people of the importance of maintaining boundaries, they're not going to believe you. I mean, let's face it, people are watching leaders' behaviors more than their words. Their actions are on display all the time. And employees are going to believe your actions more than your words. So I think that that's a wonderful example that person said, I'm aware of my actions, but here, let me just reiterate the importance of boundaries and why it's important. So I think that that's a perfect example. I love that example.
So what else can people do besides, protecting their off the clock time?
Okay. That's a good question. Workplace mental health, it's a complex issue, and therefore the solution is not one size fits all. It's more than just putting that disclaimer on your email. The response really needs to be holistic, and it needs to start with the organizational culture. And the organizational culture, I would venture to say, begins with the relationship between the supervisor and the employee. That's a key element.
Yeah.
So we need to invest in leadership training. Let's face it, most supervisors are promoted not because of their people leadership skills, but because of their technical expertise. And they need to be trained on how to create a trusting environment. They need to know how to create psychological safety for staff. And I'm not talking about being soft. I'm not talking about removing accountability. It's about open, transparent communication that's done respectfully and it's done with positive intent. In addition to providing them with the skills, we need to hold them accountable. They need to know that people leadership now is part of their role in addition to all of the other aspects of their job. I read another statistic the other day. It was from a study done by AFLAC that said that only 48% of employees feel confident that their employers care about them. I mean, we need to do better than that. We really do. We need to normalize the discussion. We need to equip supervisors so they know how to respond. And we need to make sure that people feel comfortable raising concerns if they have them. There's another study that I read that talked about, this was from SHRM, from Society for Human Resource Management, that said 26% of American workers are hiding their mental health struggles from their supervisor.
Oh,
so
my.
they're struggling in silence, right? They're struggling in silence. And when they are disclosing these struggles, yes, there certainly are a number of supervisors who respond supportively. However, this study said that 15% of supervisors were unsupportive. 8% removed them from important projects, and 7% denied them advancement opportunities.
Wow. That those percentages of people being removed from their job or being denied new opportunities, I would never have expected it to be that high.
Yeah, I mean, it's disturbing for sure. Not only is this adverse action unlawful, but it's unhelpful. And I mean, I'm not here today. This is beyond the scope today. We're not here to discuss the legal implications and the importance of addressing accommodation requests, but I would be remiss if I didn't mention this. So once again, I would just point out to leaders that there is some certain protections that people with mental illness have in the workplace. And if people are coming to you requesting an accommodation, please rely on your HR departments. They are skilled at this. They know how to address these requests for accommodations under the ADA, and they know what the requirements are. But getting back to the multifaceted solution, what I would say, Linda, is that there are really four components. So workplace culture and the supervisor-employee relationship. We've already talked about that a little bit. The legal considerations, especially around ADA accommodations, benefits, and mental health friendly policies.
So speaking of benefits, are you talking about employee assistance programs?
Employee assistance programs, or EAPs, can be hugely helpful. However, they often have low utilization rates, and mostly that's because of the stigma that's associated with mental health. So again, it goes back to culture and making it okay to talk about this. The other thing is oftentimes employees don't know how to access it, or they forget about the availability because it's only talked about once a year during annual enrollment. So it's important that employers remind people about the benefit, that they tell them how it can be accessed, and they don't wait for somebody to knock on their door and say, hey, I'm struggling, because we know they may not be knocking on the door. So instead, just make this part of your monthly communication, put it on your intranet, put it on your newsletters, what have you, so that people have access. And benefits plans. When an employer is selecting a benefits plan, this is usually around the time of year where we have open enrollment, it's important that they seek benefits that cover mental illness at the same level as they cover physical illness. Because those people who are diagnosed, we want to ensure that they've got access to care. Remember, you've got 41% of the population saying, I would go somewhere else if they can offer me better mental health benefits. So it's important that you're looking at a full suite of benefits that's going to accommodate all of their needs. And while I'm at it, I'm going to say one more thing about the benefits, which is talk to your benefits brokers, because there's a lot of other creative benefits. I know benefits can be expensive for the employers, but there are some other things that you can consider. And often these are already part of your package, but we just forget about them. So for example, financial wellness programs is another benefit that's often provided by benefits providers. Discounts on gym memberships, on-demand stress management workshops. These are all things that we can look at, as well as what's coming into play right now, or some things called subscription services and other digital wellness programs that could be a great complement to an EAP program.
I've not heard of subscription services. Can you say more?
Yeah. So a subscription services, basically it's an app that exists to provide resources like mental health screening, wellness tools, articles, meditations. Think of it as like the Uber of mental health. We're conditioned now to want things at our fingertips, self-service, and when I need it. And that's really what these apps do. And they're evidence-based. Certainly it doesn't replace a therapist, but it's a good way to give employees access to something immediately.
Well, that sounds very interesting, but are they expensive?
Not necessarily. The ones that I've researched cost about $60 per person a year. So it's a manageable investment for a small business. Say you have an organization of 50 people, you're talking about less than $3,000 a year. So it's definitely something that's worth considering or exploring anyway.
Well, thanks, Carol. So far, you've spoken about 3 out of 4 key solutions: workplace culture, legal implications and accommodations, and benefits. What can you tell us about that last component, policies?
Policies. So we talk about mental health friendly policies, and I would encourage employers to look at some of the things we've already talked about, such as expectations around off the clock time, availability of flexible work schedules so that employees can balance their work and home demands. It also helps to have generous PTO policies. And one other thing, it's kind of a policy, it also goes to culture, is do you have a formal mechanism for soliciting employee feedback? These go a long way in making employees feel cared for if their opinions are not only solicited, but then valued and responded to. But the important takeaway is that investing in mental health should be a deliberate activity. It's got to be woven into the culture. It's not just a once a year event. It can't be left up to the benefits providers or the HR department. There are so many things, Linda. You can implement walking clubs. You can implement mindful classes or start affinity groups where employees with similar needs can come together and talk about different challenges they're facing. These are all great ways to show people that you care about them.
There really are a lot of options, many that I hadn't heard about before. So what advice do you have for an organization that's just getting started?
Well, first, don't be scared by it. You don't have to do it all. Any step is better than no step. But to make sure that your actions are going to give you benefits, I would tell you to first take stock in your organization. So determine what needs have emerged. HR is a great help in this. They typically have a great bird's eye view into what the trends are in the organization. So tap into them, asking them what's working and what isn't. For example, if it is low utilization of EAP, maybe it's an awareness campaign. If it's high absenteeism, maybe you need to revisit policies around PTO and accommodations. So pick one thing to focus on first, whether it be awareness campaigns, manager training, policy implementation. Just start somewhere and then look for signs to see what's working. And of course, don't be afraid to ask your employees for feedback, because that's going to be key.
You've given us a great deal to think about, Carol. Thank you.
My
And
pleasure.
I want to thank everyone else who has joined us today to learn more about mental health possibilities in the workplace. Thank you.
Thanks, Linda.